You want to start with me, Glenda, or are you going to start again?
Yes, please go ahead.
Hi, I would like to introduce our panelists to you. We're going to be talking about HIV. I have worked with this group for over 20 years, and we have gone throughout Kane County talking about living with HIV. So I have with me Karen Smith, Lewis Hobson, and Antoine Carroll. So Karen, I would like to start with you. You've been living with HIV. If you want to tell us a little bit about yourself and how long you've been living with HIV and what the barriers and give us the good and the bad of it, okay?
Okay. Hello, my name's Karen Smith. I am the mother of 6 children and a grandmother of 7 children. My grandbabies are my pride. I tested for HIV in 1985 at Open Door Clinic. The test was reactive, non-reactive, leaning more towards reactive. But due to the fact that I really didn't want to know the answer, I let it go at that and didn't go back for a second test. But during the pregnancy of my third child, the pregnancy of my third child, I had no choice but to get retested, and the test came back positive. Fortunately, the baby was born, when at the time, they didn't test babies but later on, when she got older, she was negative. And then I gave birth to 4 babies since I've been HIV positive, all of them negative. The medications were a struggle. In the beginning, in 89 is when I started taking AZT, and I had a bad reaction to it. It wiped me out. It wiped 800 something T cell count, pretty strong immune system, all the way down to like 14. And it went on for a few years. And I'm thinking, if I'm dying, why do I look so good and feel so good? And then later on, studies showed that just because your immune system's low doesn't mean you're dying. So my immune system with the newer medications as they came out got stronger again, but I was diagnosed with AIDS in 1993 after the episode with the AZT. And then my immune system did get stronger as newer medicines came out, but I had a doctor that liked to, as soon as new medications came out, he'd put me on them. There were times when I was taking 20, 30 pills a day, and due to side effects from medications, I was in the emergency rooms quite often and had quite a few scares. But I got past all that and through all that, and I made it to 1 pill a day. And I'm 61 years old, and I've had HIV since 1985. Like I said, I gave birth to 4 children, and all 4 of them were negative since. And I had 3 long-term relationships, and each one of them were negative. And now today, I'm still diagnosed with AIDS, and it's 1 pill a day. I mean, it makes it simpler, but that's pretty much my story.
Thank you, Karen. Lewis Hobson, can you take your speaker off and tell us a little bit about you and how long you've been living with HIV, and give us the ups and downs of living with HIV?
Go ahead, Francis. Yeah.
No, you don't have to.
Oh, well, my name is Lewis Hobson. I was diagnosed in June of 1998, although I kind of knew that I had been infected in 1986, and I waited, 11 years before I went and got tested, something like that. But when I was diagnosed with AIDS, and I was told that I had less than 6 months to live. And when I went to the doctor to get on treatment, they were like, well, we don't think you're gonna die. We're gonna put you on some medicine and it'll give you some more time. And I got on meds, which was really hard at first. I had a hard time keeping down food. I vomited, I had diarrhea, I lost a lot of weight. Uh, but eventually things got better and I was able to tolerate the medicine much better, especially as it progressed and the medicines got easier to take. And I built my immune system back up and I am well above the, what is it, 350 T cell count now. Um, it's been a struggle, but it's better than being dead. Um, and through this struggle, I've met a lot of interesting people who, like me, struggle and have that will to survive. And I think as long as you get on the meds and keep a positive attitude and eat healthy and exercise, I think things will be much better. And the earlier you get diagnosed, the better off you'll be.
Thanks, Louis.
You're welcome.
Antoine Carroll.
Thank you, thank you. Well, I'm Anton. I go by Anton X mostly. For me, I'm like newer to all this, I guess. So like in 2015, I was officially diagnosed, but I had known probably since 2014, late 2014, just kind of like avoiding, but that's always the first step. Number one, I did a lot of it. But, I think for me, I hear a lot of people talking about it, but like, I just took my medicine now. I'm just thinking about the stories and like being able to like take that one pill and have this advancements that people had to like struggle and lose their life for and then have access to and things like that. That's been my main thing, for my short 27 years on this planet, I've been really just creating not only just access, but like it's right there type of access. Like there's no need to grab it. It's right there in front of us. I've been an advocate. I'm an artist, I'm a yogi. Mainly, I've just been kind of living through HIV and really trying to find strengths, like whether that be like my yoga practices or like literally meditating so much more than I've ever thought I could. I think that's the first step for me is that like I do have to take my medicine, but I think like it all starts internal. Yeah, I'm pretty simple otherwise, I'm just, whooping HIV and increasing my health over time, I suppose.
Okay, thank you. Would any of our other people like to talk to them, ask questions? Do you have any questions for them or for me? I have been doing HIV for over 25 years, but I've been on a, for the last 2 years, but I still know a little bit about it. They talk about their immune system, and we all know that a healthy immune system is anywhere from 800 to 1500. And when it drops below, I think I heard Louis say now 350, because it used to be when it drops below 200 was when you considered an AIDS diagnosis. And even though the AIDS diagnosis is on the paper, the CDC requires that. With the new meds they have now, that's a reverse. Most of you guys are taking the one pill and you have like a HIV status, am I correct? Isn't it like HIV because your immune system is up and the virus is low, below 200, below 350?
Mm-hmm.
Yeah.
Is that correct? Okay.
20.
So my hat goes off to you. Thank you. I appreciate you. Deborah, Alma,
Yes.
questions?
I have a question. Miss Karen had touched on, you know, and the other speakers did too, on how they were in denial at first, like they knew they had it, and then they kind of waited to, and like what was the, I guess and this is for everybody, like what was the thought process behind that? Was it just like avoidance, like if I avoid it, it'll go away? How did you know, like how did you know that you had been infected? Did the person that you had sex with, like did you find out they had it? Like what was, how that I guess that's my question.
Yes, the
Yeah.
person, the father of my children did have it, and the people that were closest to us that were associated with us had already tested positive also. So I pretty much knew, even with a positive negative reaction test, but I was pretty much in denial and didn't want to face it, is what it was. But I knew that I had to. So I mean, didn't have a choice with a pregnancy. So
Let me ask this question. How has this been with the COVID-19? Has that been a scare? Have you guys, I know, I'm asking, have you taken the vaccine? Was there, give me a little bit on that.
Well, anxiety is real. There's already anxiety from one virus, and like I thought that like first things first, like I don't want two viruses in my body. Like first things first, like so yeah, I'm vaccinated. I haven't got the booster just yet, but I was like one of the first people vaccinated. I think I was vaccinated in like late December, in like early January somewhere, like very, very first people in group of people. It's been okay. I haven't had to worry about COVID as much, which is kind of helpful because then I don't have to worry about, again, my HIV and take my medicine. But, you know, it was really, really scary at first without any vaccination or any type of understanding of what was going on.
Okay, thanks. What about you, Louis?
Well, it affects me in the way of when this virus came out, I was very paranoid. I stayed in the house a lot, gained weight a lot, kind of isolated myself from other people, especially people that I knew that weren't vaccinated, because I have gotten not only the 2 shots for Pfizer, but I also got my booster shot. I feel better about my health and thinking that, you know, this has built up my immunity against the COVID-19 virus. And I'm less scary about it than I was in the beginning, because in the beginning I was very, very petrified. And
No side effects? Were you kind of, wondering with the medications you're taking and with this new virus vaccine? Was there kind of like a hesitant about the side effects from that?
not for me, because I knew they were kind of like working with viruses that were similar to HIV. And I thought, at one time, I kind of thought having HIV would kind of give you a leg up on this, since it is another viral disease. But I don't think that's true. But
It's funny you said that, because when they were going through all of these different medications, one of the meds came up. I was like, that's an HIV med.
right, yeah.
And they were kind of talking about, experimenting with it.
So, yeah.
With me, with HIV, it was HIV that to be feared, not a treatment. With me, with COVID, there were so many horror stories about the vaccinations that I was scared before, during, and after. It was like, but then I had to come to realization and know that, I did this to protect myself, and I have to believe that that's what I did, not,
Okay.
fall for all them horror stories.
Okay.
But yeah.
I think the worst part of getting vaccinated for me was standing outside in that cold line waiting to get in the building.
It was not that cold.
It was March. It was cold.
He was at our clinic, Alma and Deborah and Glenda. And he know I was rushing to get people inside the building. So anyway, thank you guys. We thank you so much for sharing with us on HIV, and continue to be well, to be healthy. I'm glad you're down to 1 pill a day. When I started at the clinic, I remember Karen, you were taking those 20 or 30 pills a day.
Yeah.
We've come such a long ways with HIV. Women
Yeah.
can have children without using a condom now, and their children are not infected. So I'm hoping that the same thing happened with COVID, so we can get it under control and just maybe master it like we do the flu. So thank you guys. I really appreciate your help in this with this World AIDS Day event. Thank you.
Can I bring up one more thing? I'm sorry. I was going to ask about, because you guys mentioned COVID and, you know, the virus. What were the similarities that you saw, you know, when people, you know, with the COVID virus and HIV, do you feel like, and AIDS, like, did you feel like some of those same stigmas mirrored each other?
Oh, yes, definitely.
Absolutely. Like
The death.
replica images. Like
Yeah.
replica images, yeah, like lack of care. Who was the first people, the highest, like, you know, because I mean, I don't know if any other Black people remember at one point, like Black people were literally saying, like, we good, we can't get COVID. I don't know, they felt that they were okay. And then like 2 weeks passed, obviously, and it wasn't true. But like things like that, and then there was a lack of access, and there was a this type of conspiracy things being thrown into our community or stuff like that. Like I know Karen talked about that as well. Like some of like the horror stories, like people are still telling me like I'm going to turn into a zombie or some weird.
Yeah.
I heard that the other day, you know, so crazy.
Same. I always tell people I'll let you know when I grow a tail. Because I have the vaccine and the booster. I think I got my booster right away. I'm ready to have my life back, is what I keep saying.
I was talking to somebody one time and they were saying, you know, look at all of this stuff that they're doing for COVID. Said if the United States had done that back in the 80s when AIDS came out, that we wouldn't have as big a problem as we have now. And I was like, you know, you're right. I say, but in a way, AIDS kind of provided the way for them to handle and treat this disease. Without the experience that they had with HIV, I don't think they would have been as advanced with viruses as they were when COVID came along.
Right. So with COVID, with all I went through with HIV, I had so much fear of COVID that I was sanitizing everything, repackaging everything. I wouldn't even leave the house. I had my daughter going to the store for me, setting things on the porch. And and people told me I was doing way too much, and I developed anxiety from it all. And it's like, I was literally poisoning myself with bleaches and disinfectants. I had to slow down and quit that. I had to get a grip on it.
Yeah.
I would like to ask a question with regards to lifestyle changes that you made as a result of being diagnosed with AIDS. Aurora African American Health Coalition is focused on health. We look at it from a holistic perspective. And I'm wondering, did you do any dietary changes? One of you mentioned that you're a yogi.
Yes.
What type of other changes did you make in your life besides taking the medication to help keep you and others safe and healthy?
With me, I never touched a cigarette, alcohol, or drug ever again.
Okay. Did you change your diet? Did you?
I tried to eat as healthy as possible. Yes.
When you said you tried to eat as healthy as possible, what type of foods did you identify as healthy foods that you would eat?
I stopped eating like a lot of fried foods and started baking more, and like instead of frying chicken or pork chops, I would bake food more.
All right.
And that's basically it. Just cut out a lot of junk foods and slow down on my cholesterols. I don't know. I didn't do a whole lot. I stopped eating pork. I don't know why. I just did. I didn't, because I was anemic all my life, and a doctor told me that I needed meats with iron, or, because pork didn't provide that. So I just stopped eating pork altogether. Even
And
though I
what
was
about you, Lewis?
Well, I didn't really change my diet so much because I had changed that years ago where I basically quit frying food. The only thing that I fry now is fish, and that sometimes I got a way where I can bake it in the microwave. But everything is baked now. I eat a ton of vegetables. I have a ton of salad and salad dressings at my house. Uh, I have a lot of frozen vegetables also. Uh, and I try
And
to
what
stay
about,
away from the potatoes and the pasta and stuff like that as much as possible.
and what about exercising?
Exercising, well, that's an issue with me because I have bone problems and bone density problems and arthritis and some other issues. So I'm trying to work up to getting back to exercising.
All right. And
I'm
what
with you.
about,
I'm sorry.
Andrew mentioned that he was a yogi. Did you make any other lifestyle changes?
I just think it's all about how I think about life in general, like my whole health, my mental health, whether that be physical, mental. I've always been more into like fruits and vegetables than like meat in general. It's kind of been like an 80-20 split between that.
Mm.
So I've been pretty okay with that. I think the biggest change is to how I think about my life, what I think about my future more than anything. I feel like before HIV, it was like I had some goals, but it wasn't really like, okay, avoid this, that, and the other, right? Like now I know like more than certain. That's why I say like through like being a yogi or meditation, like where I'm headed, like literal direction my life is headed to. That's mainly the biggest change I've made. Like, and yeah, I do work out a lot more because I used to work out for fun, and now I take it a little more serious than just fun.
Thank you very much.
I would like to add something about exercise, because with me, some of the medications caused lipodystrophy. Like one of the medications literally destroyed my face. Took all the muscle and fatty tissue off my face, and it did it, and it's happened to my body also. And so I tend to want to exercise, not necessarily just exercise. I like to move around. I don't like to lay and sit around, because I think it makes my body, I'm a very thin skeleton like person. Oh, naturally. So the medications, when they did the thing on my face and my body, it just intensified it to a very worser level. But so I like to try and stay active instead of sitting and laying as much as possible. And I mean, my grandchildren keep me active, cleaning house, going for walks, whatever I can do, just to stay active, because I'm afraid that the sitting and laying adds to the body, weakening.
Thank you for sharing that.
I have a question. I heard somebody mention mental illness, mental health rather, and I was wondering, did you guys in your when you first was diagnosed with AIDS, HIV, did you guys receive counseling, or are you continuing counseling? How do you keep yourself upbeat and then having a positive attitude?
Well, when I got diagnosed, they immediately hooked me up with a psychiatrist because I was receiving services at Loyola University Medical Center in Maywood. So they hooked me up with a psychiatrist, and I still pretty much see a psychiatrist and a psychologist still today, although right now I'm looking for new ones, but Yeah, that definite thing with me, the mental health, especially this time of year, because the days are shorter, it gets darker quicker and it's darker longer. And I suffer from what they call seasonal affective disorder, which means when it gets winter time, I'm like the bears. I like to hibernate. So uh, I need things to keep me up and moving around and not laying in the bed all day.
And for me, I feel like it's a lot of internal work that I've been doing. I am also seeking therapy. I mean, I've had therapy before my diagnosis, that helped me unlock some things in my life that was dealing with that had to do with trauma. I think, yeah, mostly now it's just a lot of like internal work that I've been doing. Like, like I don't know, I was a wild child. I'm not gonna pretend. So mostly just that. Like, okay, what is it like to be just, normal or sitting at home or being a homebody? I really do enjoy it now. So, just getting that state of mind. Like, I don't always have to be up doing something. That took so long for me to get to.
Thank you, guys. Appreciate that. Good question, Deborah. Okay, Glenda, we're back to you.
Thank you. Thank you so much. I just appreciate everyone sharing their story and how it related to kind of where we are now. I definitely agree with kind of the advanced in medicine and on how to treat viruses. I know there was a lot of hesitancy in the beginning with people not wanting to take the COVID vaccine because they're like, that was just too fast. And and I was like, well, they've had lots of practice, not just with this one, but with other viruses. So I definitely see the similarities there. Just thank you guys. Thank you, Miss Mary. Thank you, Louis and Antoine, Miss Karen, Miss Alma, Miss Deborah for joining us today. This was a very lively discussion. Is there anything else you guys want to add? I guess, it's a really good question because we're not sure who's going to listen to this. So what would you tell you when you knew that you had it and you hadn't got tested yet?
Easy. Knowledge applied is power. Because a lot of people say knowledge is power, but like I think the application of it is really, really important. Like because I do test it and things of that nature. So I always tell people like, oh, I'm here to give you more information about yourself. That's literally how I look at it. Like, oh, you're gonna leave this room with something new that you know about yourself, no matter what it is. So I think that would be something I tell them, like, it's better to like have the information about yourself opposed to like, kind of just like leaving it in the dark or just waiting to see maybe it'll come around later type of thing.
Thank you, Miss Karen. Louis, would you like to go next?
So like I guess like days you would like to leave behind to the youth who are positive but probably don't feel like they
for the youth, it's kind of sad because I would like to see big groups of youth, especially high school students. I would like to see them in some sort of program where they can have people that are positive come and speak before them and tell them what it's like and what you can do to prevent getting this. Because some of them just aren't getting the message and they think, oh, well, if I get this, then I'll only have to take one pill a day. And they don't realize the high rate of side effects and that we have and the traumas that we suffer because of it. And I think if they got this information early on and took it seriously, that we would have a lot less cases than we do now.
Thank you.
And another thing we still have to remember, I know, Karen, you asked the question about you being white. It doesn't matter. What we're trying to do is, regardless who the person is to give them the information And one of the things that we still know is HIV is still high in African-American communities,
Yes.
you know.
And
So
telling-
we do know that.
important. It's so important to tell people that, right? Like, you know, it's not equal. It's not biased, but it's also not equal, right? Like I think it's so
Mhm.
important to tell people stuff like that and use language in such a way that, you know, it gets the point across just straightforward, you know, because I
Yeah.
don't sugarcoat it. I got little brothers and I have like at least 6 underneath me. So I have to be honest to them. You know, I have to let them know what's happening in the world.
Mhm.
Mhm. Okay. Thank you.
Thank you.
You're welcome.
Thank you, everyone.